New this morning, the CDC has new guidance when it comes to the drug to treat malaria and the coronavirus. Now, it originally had information about prescribing drugs to treat malaria, rheumatoid arthritis, and lupus. Well, now the site says there are no drugs approved to treat this virus, COVID-19. President Trump has praised the treatments and pushed for them to be made more widely available. Liz Kotelik reports people who need this medication in Colorado are now having a tough time getting it.
Here you go.
It's one small pill twice a day that gives Chris Singrani a normal life.
Without it, I think I'd still be struggling with a lot of, especially on the fatigue and just getting sick and worn down.
The husband and father of two was diagnosed with Sjogren's syndrome in 2018. He was given a medication called hydroxychloroquine, which is derived from a drug made to treat malaria, but found to be helpful for people like Chris who have autoimmune disorders.
To take that drug, I have to have like an extra eye exam every year from my doctor because there could be side effects.
Like retinopathy and heart problems, but when controlled through a doctor, it's a medication that's been life-changing for many. And for the first time, a call to the pharmacist gave Chris a glimpse of life without it.
They were seeing a flood of new prescriptions coming in from people that had never taken the meds before, had never been diagnosed for it.
His doctor had to help him finally get his prescription filled because people have been finding ways to get their hands on hydroxychloroquine just in case it can treat COVID-19, a scenario that has not been scientifically proven yet.
I understand the fear. However, I would say that needs to be done very, very cautiously because we don't know that the medicine works.
Dr. Kevin Dean is a rheumatologist with UC Health. He says his patients have also had a hard time getting the drug, but thankfully at this point, it just took some calling around.
What I really hope is that we'll get good studies done to either prove or disprove that it works in COVID, and if it does, great. If it doesn't, let's get away from it and move on to something else.
Results so far have been mixed from small clinical trials in France and China. And Nine Health expert Dr. Paul Coley says we simply need more.
Most all of these studies have actually looked at patients with very mild illness. And what we know about the disease is that 80% of people with mild illness will recover on their own. So scientifically, we can't really hang our hat on that data.
The Department of Health and Human Services agrees, but because the drug may offer benefit, they ordered 30 million of these pills for the national stockpile, saved for people who may eventually need it.
So this would be a therapy available to you if we had run out of all options. But early in the disease or to prevent disease, there's just not enough data.
And importantly, it's a pill.
There are side effects that you need to be careful about.
That could cause harm when not taken correctly. But for Chris, it's a pill that means everything to live his life comfortably.
And I would love to see that as the fix or the cure. However, also I think it needs to be done in a way that the folks that need it for other reasons still have access to it while the drug companies continue to ramp it up.
And that's able to happen when people are not stockpiling it, which both Dr. Paul Coley as well as Dr. Dean say is just not necessary, even if that drug does prove to be effective. And by the way, there's a big study happening as we speak in New York that scientists are very eager to get the results of. We should get those results here in the summer, so a couple of months. So that is something that's exciting, that we could finally get some real scientific proof about whether this drug actually helps or does not. But in the meantime, Corey, I talked to dozens of people who rely on this medication to live comfortably just like Chris, and all of them have told me that it has been very difficult for them to get their hands on this drug here in Colorado, which is very concerning, as you can imagine, for them.
Yeah, absolutely. That's tough. And you can see why people are just jumping at any hope of there being some type of treatment or whatever for coronavirus. But this is just so preliminary.
Yeah, that's right. And I completely agree with you on, you can't really blame people for hearing that this is a potential miracle treatment for COVID-19 and wanting to protect themselves and their family members. But I think that's why this report is so important to understand how this is affecting other people in your community who need this medication, and also just to calm some fear that, especially with the stockpile, if you get into a position where you get into the hospital and you need this medication, the chances of you not being able to get this drug are very, very slim right now.
Yeah, it is scary for the people who need it right now, for sure. All right, Liz, thank you.